Okay, hello, I'm Lauren. I'm going to be your nurse today. I'm doing your cardiac and pulmonary exam. This is JW. Or if you have any questions as I go, just let me know and I'll be happy to answer them. I'll also be explaining what I'm doing as I go.
Okay.
All right, so I'm going to first start by palpating the carotid artery. I'm making sure not to palpate high up at the carotid sinus. I'm going to make sure to palpate at the carotid artery medial, the sternomastoid muscle. If I did palpate the carotid sinus, then that could cause his blood pressure and his heart rate to go down. So we don't want to do that. So I'm going to go ahead and palpate. And then the other side. Great. And I'm making sure to do one at a time because if I did both of them, that could stop the arterial blood flow to the brain, and we don't want that to happen. So now I'm also palpating to feel any thrills. If I did, I would need to auscultate for any bruits. I'm going to go ahead and auscultate. Using the diaphragm and now the bell. Great. So now I'm going to auscultate the heart valves, and I'm going to use the diaphragm and the bell when I'm auscultating as well. So I'm going to first start in the second intercostal space, right sternal border, listening to the aortic valve. Moving to the left sternal border, second intercostal space, listening to the pulmonic valve. Moving down to the third intercostal space, listening to the tricuspid valve. And now moving down to the fifth intercostal space, intercostal space, midclavicular line, listening to the mitral valve. And here I'm going to listen to this apical pulse and count that for 1 minute. Okay, great. So his apical pulse was 78. So that's a good resting heart rate. Now I'm going to go ahead and move, and I'm going to listen to using the bell side. So listening to the second intercostal space, listening to the aortic valve. Listen to the pulmonic valve, the tricuspid, and now the mitral. Great. So now I'm going to move on to the pulmonary exam. I'm looking at the thoracic cage, looking at his shoulders, looking at the muscle mass, making sure that it's symmetric. I'm also looking at his breathing pattern, making sure that he's not in distress, watching the chest rise and fall, making sure that it's symmetric, looking at the depth, making sure it's even, looking to see if he's using any intercostal muscles, which he's not, and he doesn't appear to be in any respiratory distress. So now I'm going to go ahead and palpate. I'm palpating to see if there's any masses. Is there any pain or tenderness?
Mm-hmm.
Great. So now I'm going to go ahead and palpate the tactile firmness. So I'm going to use the palm side of my hand, and I'm going to have you say 99 each time you feel my hand.
99, 99, 99, 99, 99, 99.
Great. So with tactile firmness, I wanted to feel the vibration against each time that you said 99, and I did. I was also feeling for symmetry as I went back and forth. Now I'm going to auscultate the lungs. And I'm going to have you breathe in and out each time you feel my stethoscope. And I'm going to be using my diaphragm. And I'm going to start above the clavicle. So I went from above the scapula to the other side, and then down to the second intercostal space to the other side, third intercostal space, fourth intercostal space, and fifth intercostal space. And I was going from side to side. I was checking to see if they were, I was comparing each side to make sure that they were the same, and also listening for any crackles, wheezing, or rhonchi. I didn't hear any. They were all clear bilaterally. Now I'm going to have the patient turn around, and I'm going to examine posteriorly. So now, again, I'm inspecting, I'm looking at symmetry, I'm watching his breathing, watching for symmetry, I'm watching for the rate, the depth, looking to see if there's any intercostal muscle use, which there's not. I'm going to now palpate. I'm feeling for any pain or tenderness, any masses again. Was there any pain, tenderness?
Nope.
Okay, great. I also was looking at the shoulders, making sure that that's symmetric. Now I'm going to go ahead and I'm going to do the tactile firmness as I did anteriorly. I'm going to have you say 99 each time you feel my hand.
99, 99, 99, 99, 99, 99, 99, 99.
Great. And again, I did feel those vibrations. So now I'm going to check for the lung expansion to see if that's symmetric or not. So I'm going to take both of my hands. I'm going to place those at the 10th rib. I'm going to expand my hands out, and then I'm going to scrunch up some of the skin, placing my thumbs close together. And go ahead and breathe in and out. One more time. Great. So as he was doing that, I was watching to make sure my thumbs were going out and in evenly, and they did. Now I'm going to percuss his lung fields, and what I'm going to do is I'm going to take my left hand, I'm going to place my middle finger where I want to percuss, and then I'm going to take my right hand and I'm going to tap 2 times quickly and the DIP joint on my left hand. So I'm making sure, I wanted to hear a nice resonant sound, and I did. I want to make sure that I avoid any bones like the scapula and the ribs, because that will cause a dull sound. So now I'm going to auscultate the lungs as I did in the front. And just take a deep breath in and out for me as you feel my stethoscope. I'm going to go above the scapula. Moving down to the second intercostal space. The third, the fourth, the fifth, and laterally. Great. So again, I was assessing his breath sounds, making sure to go from side to side, making sure that it was symmetric and there wasn't any wheezing, bronchi, or crackles. So now I would perform 3 tests. I'm going to perform 3 tests. These tests, if I think that the patient has pneumonia or if they've been complaining of coughing or pain while coughing. The first one is going to be bronchoscopy, and I'm going to have you say 99 each time that you feel my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99.
Great. So I couldn't hear what he was saying. It just sounded muffled and indistinct. That's what we want. If I could hear him say 99 through my stethoscope, then that could mean that there was some consolidation in his lungs. Now the second test I'm going to perform is the whisper pectoriloquy. So I'm going to have you whisper 99 each time you feel my stethoscope. Great. So I couldn't hear him saying 99 through my stethoscope. I could tell he was saying it because I could see his chin moving. But we don't want to be able to hear it. If I could hear it through my stethoscope, then that would mean that, again, there's some consolidation. So the last test I'm going to perform is the ectopathy, and I'm going to have you say E each time you feel my stethoscope.
E, 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 E.
Great. So I heard E each time that he said it. If I heard an A sound, that could mean, again, that there's consolidation. If I needed to, I would perform that on the anterior side as well. But that concludes our cardiac and pulmonary exam. Do you have any questions?
No, ma'am.
All right. Thank you so much.
Thank you.